And some of those supplies include things like socks and underwear, hygiene products, as well as harm reduction supplies. For example, crack kits, as well as naloxone kits.
Those multiple uses will range from providing essential primary health and harm reduction services to COVID-19 and vaccination efforts at homeless shelters, particularly important in this working class neighborhood with a high proportion of new immigrants and concentrated with affordable housing units. The initiative is spearheaded by Parkdale Queen West Community Health Center in coordination with the UHN and TELUS Health.
And then this part of the mobile unit is the reception area or the counseling area. While we move into the back where we actually can provide direct primary care services right here on the mobile unit.
The co-lead of the mobile health clinic in Toronto, Dr. Andrew Buzari, says those who need health care most, especially amid COVID-19, often have the toughest time accessing services.
Hospitals having to rethink their role, and that this is so much of success, so much of saving lives is going to hinge on different ways of supporting and partnering with communities.
Dr. Nahi Dasani says COVID-19 has had a disproportionate impact on low-income and racialized people.
Many people in our communities are fearful or anxious or feel traumatized from experiences from healthcare, so they avoid it. So when we're able to provide that healthcare where people are at, it makes a huge difference.
That change is needed urgently. Toronto's COVID-19 case data shows significant disparity along ethno-racial and socioeconomic lines. South Asian and Indo-Caribbean people make up the highest proportion of cases in this category. As of November 30th, nearly 80% of all reported COVID-19 cases were in people who identified with a racialized background.
Only by taking these steps will we be able to provide vaccination and address issues like vaccine hesitancy, which is common in this population in ways that are trauma-informed and that are built on trust and relationships.
Mayor John Tory says the city has implemented targeted equity measures to support neighborhoods with higher COVID-19 numbers. That includes expanding testing sites operating this weekend, plus more support for those who test positive and can't work.
We can no longer have this willful neglect. We have to be able to change the way we deliver care.
Mobile clinics of this kind are already in use across the country. We're told this one here in Toronto will hit the road soon. The commitment is to use it for the next 3 years, but the goal is to make it a permanent tool for those who need it. In Parkdale, Maleeha Sheikh, City News.
While a new president tries to get to work, one major piece of business remains from his predecessor. Democrats in the House of Representatives are ready to send their lone impeachment article against Donald Trump to the Senate on Monday.
We all want to put this awful chapter in our nation's history